2 months ago, if you wanted ChatGPT to help diagnose a symptom or explain a medical concept, you had to pay for premium. Not anymore. On June 18th, OpenAI rolled out a health intelligence upgrade so powerful that it now performs at the same level as their most advanced thinking models. You know, the ones that take minutes to reason through complex problems. But here's what makes your jaw drop. It surpasses physician-written answers on actual accuracy benchmarks. That means the free version you use right now is better at medical guidance than what an actual doctor might write. This wasn't some quick ChatGPT patch. OpenAI worked with more than 260 physicians across 60 countries, representing 26 different medical specialties, everyone from cardiologists to oncologists to pediatricians. They didn't rush it. They spent months refining it. And the results speak for themselves. Flagged health responses, that's OpenAI's own internal safety net catching potentially dodgy medical advice, dropped 71% in just 2 months. That's a staggering improvement. All 230 million free ChatGPT users now have access to this. No subscription needed. This is the biggest change in AI-assisted healthcare access we've seen yet. Here's the thing, AI and healthcare have always had a weird relationship. For years, doctors have been terrified of AI giving wrong medical advice. And honestly, they had a point. Early AI models would confidently state medical facts that weren't just wrong, they were dangerously wrong. They'd hallucinate drug interactions or miss crucial symptoms because they trained on old data or incomplete sources. So OpenAI did what any responsible company would. They put health features behind a paywall. If you wanted ChatGPT to help with medical questions, you had to subscribe to ChatGPT Plus. That was partly a safety call, but let's be real, it was also a business decision. It kept healthcare AI locked away from the 230 million free users. Paid users got the feature. Everyone else got nothing. That created this weird split world where someone with $5 a month got better health guidance than someone without a credit card. But over the last few months, something shifted. OpenAI's researchers got serious about accuracy. They brought in physicians from all over the world, cardiologists, surgeons, specialists in 26 different fields, and said, "Help us build this right." The safety net worked. The errors dropped dramatically. So now, with that confidence behind them, they are taking it free. So what does surpasses physician-written answers actually mean? Here's the specific part that's wild. OpenAI tested their new health model against benchmarks they call their most challenging health evaluations. Think of these as the hardest medical questions you could ask a language model. The kind of questions that separate a system that kinda understands medicine from one that actually gets it. GPT 5.5 Instant now performs at the same level as OpenAI's frontier thinking models on those tests. And if you know anything about thinking models, you know they are the ones designed to reason slowly and deeply. They take their time, they work through the problem step by step. For GPT 5.5, Instant to match that on speed while handling medical accuracy is genuinely impressive. But the real proof is simpler. They stacked the new model's medical guidance against actual answers written by physicians on real healthcare questions. The AI's responses outperformed the doctor's responses on accuracy benchmarks. That's not a close call. That's not competitive. That's better. Now, before you think I'm saying AI is now a replacement for a doctor, I'm not. This isn't about ChatGPT replacing your doctor. It's about a tool that can reason through medical information at a level that's actually trustworthy. So what can you actually do with this right now? Let's get concrete. Someone wakes up with a weird rash. Instead of waiting for a doctor's appointment, which might be weeks away, they pull out their phone, open ChatGPT, describe the rash, and ask what it might be. The new model can work through the differential diagnosis. Is it an allergy, a fungal infection, a viral rash, dermatitis? It'll ask clarifying questions. Where is it on your body? Does it itch? When did it start? And narrow down the possibilities. It won't diagnose you, it's not licensed to, but it'll give you medically accurate information to help you decide whether you need to see a doctor now or if you can wait. Someone's taking medication and wondering about side effects or interactions with something they bought at the pharmacy. They ask ChatGPT. They get reliable information, not a hallucination. A parent whose kid has a fever wants to know when to worry. Instead of digging through WebMD and getting scared by worst-case scenarios, They get clear, physician-vetted guidance. A diabetic person wants to understand how different foods might affect their blood sugar, or someone with anxiety wants to understand their treatment options. You're not replacing a doctor's visit. You're getting trustworthy AI-powered healthcare information at 3 in the morning when you need it most. Now, ChatGPT isn't the only AI touching healthcare. Google's Gemini has health features. There are startups building AI doctors. There's specialized medical AI software in hospitals. So what makes this update significant? Reach, for starters. 230 million free users means the impact is massive. This isn't a tool for hospitals or rich people with premium subscriptions. It's for everyone. But there's something else. When ChatGPT does healthcare, it's built from the ground up as a conversation. You describe symptoms, it asks back. It's collaborative. Other AI health tools often feel more like searching a database. You input data, you get output. ChatGPT's approach is more like talking to an informed friend than using a search engine. That conversational element matters because healthcare is nuanced. Your symptoms mean something different if you've got a history of heart disease versus if you're perfectly healthy. The model needs context. It needs to ask questions. It needs to refine its understanding as the conversation goes. That's where the 260 physicians come in. They weren't just helping OpenAI build accuracy, they were helping shape the conversational flow. The bedside manner, basically. This isn't just a smarter database. It's smarter medicine translated into AI form. Okay, so if free ChatGPT can now give medical guidance that beats doctors' answers, what does that actually mean for the healthcare industry? And here's where it gets complicated. Nobody's saying doctors are obsolete. What's happening is a change in the support structure. Right now, if you've got a weird symptom at midnight, you either panic search the internet or you wait to call your doctor. Neither's great. With this, you've got a trustworthy starting point that takes pressure off emergency rooms filled with people who just needed information. It empowers patients to ask smarter questions when they do see their doctor. But it also raises real questions. Who's liable if the AI gives guidance that turns out to be harmful? OpenAI says it's not a diagnostic tool, but if someone follows its advice and gets hurt, that's messy legal territory. There's also the doctor perspective. If patients are getting excellent medical information for free from ChatGPT, how does that change what doctors charge for? Do doctors need to become more specialized, more diagnostic-focused, less about delivering standard information? These are questions the healthcare industry is just starting to grapple with. And then there's regulation. Health Canada, the FDA, the European Medicines Agency, they all need to figure out how to oversee AI that gives medical guidance. It's not a drug, so traditional approval processes don't apply. But it's clearly healthcare tech. So you want to actually use this. How do you get the best results? First, be specific. Don't just say I have a headache. Tell ChatGPT the whole context. Where's the pain? How long have you had it? What makes it worse? Any other symptoms? Any medical history that matters? Medications you're on? The more information you give it, the more accurate the response. Second, ask follow-up questions. Healthcare is collaborative. If ChatGPT suggests something might be a tension headache, ask it to explain what a tension headache is, what usually causes it, what things you can do about it. The conversational back and forth is where the model shines. Third, don't treat it as a replacement for a doctor, treat it as research. Use it to understand what you're dealing with, to ask smarter questions when you do see your doctor, to get a second opinion on something your doctor already told you. It's a support tool. Fourth, know its limits. If you're having chest pain, you don't ask ChatGPT, you call an ambulance. If something feels urgent or life-threatening, you get professional help. Full stop. ChatGPT can help you understand health information and think through non-emergency questions. And finally, remember that it's trained on medical literature, not your personal data. It doesn't know your full medical history unless you tell it. Here's what it boils down to. OpenAI just handed 230 million people a medical information tool that outperforms doctors. That's not hyperbole, it's what the benchmarks show. And they did it by bringing in 260 physicians from around the world, listening to what they learned, and building something trustworthy. This matters because healthcare access is unequal. A rich person with a good doctor and time to spend on their health has advantages. Someone working 2 jobs, living far from medical care, or in a country with limited healthcare infrastructure doesn't have those advantages. This tool doesn't solve that problem entirely, it never could, but it takes the edge off. It gives you reliable medical information at 3 in the morning. It helps you be a smarter patient. It lets you understand what's happening in your body without Googling and spiraling into medical panic. The hard questions haven't gone away. Liability. Regulation, how this reshapes medicine and the economy around it, those are still unsolved. But the fact that OpenAI felt confident enough to make this free to everyone suggests they actually do think this tool is trustworthy. That's the biggest change we've seen in AI healthcare in years. Follow for daily AI news to see how this story unfolds.